Good afternoon, everybody, and welcome to the Spring 2025 School of Public Health Doctor of Public Health Commencement and Hooding Ceremony. Today, we're really here to recognize and celebrate the accomplishments of two graduates, Joy Alexander and Lauren Finkley. I want to extend my personal congratulations to both of you. And I would invite everyone to give you a round of applause, but they already did that. So now, Lauren and Joy, your admission to Georgia State's DrPH program means that you were already ready when you came to us, and really you really additionally had the potential for even greater levels of impact. The DrPH program and your engagement with your faculty and peers, hopefully, expanded your knowledge base, provided new insights on complex public health challenges, and increased your understanding of why your work and your leadership are so urgently needed. While this is a day for celebration, I also have to acknowledge that you're graduating at a really challenging time for public health. To share only a few realities, an 18% reduction in staff at CDC has upended the lives of dedicated public health servants with expertise in critical areas, including environmental health, asthma, injury prevention, violence prevention, lead poisoning, smoking cessation, and the health impacts of climate change. So really, really broad, wide impact. In addition, the NIH has laid off over 2,200 employees, and the FDA has also let go 3,500 employees. Nearly all of USAID's employees have been terminated, and the agency has cut 90% of its foreign aid and contracts. Turning to public opinion, a recent survey found that only 40% of U.S. adults say that it is extremely important for parents to have their children vaccinated. That figure is down from 58% in 2019 and 64% in 2001. An ongoing measles outbreak has hospitalized nearly 90 people, with nearly 1,000 cases reported nationwide. 2 unvaccinated children have died. I'll admit that I really struggled to find the words that adequately convey the range of emotions that these public health workforce cuts and vaccine preventable deaths elicit in me. We know that investments in public health help people enjoy longer, more productive lives. We know that investment in public health saves lives. We're in a difficult moment, but public health professionals are resilient and adaptable. The outlook for public health these days is often described as uncertain. What I'd like to remind everyone here is
That's okay. I have a 3-year-old. I have a 3-year-old granddaughter who loves to play the freeze game with me. So whatever I'm doing, she'll say freeze. So for those not familiar, the tool Lauren developed and evaluated for her dissertation was called This is a Test, of course, standing for Training and Exercise Simulation Tool. If that was a test, Lauren, you clearly passed with flying colors. Lauren, I feel the need to acknowledge that today is bittersweet. Having successfully completed your DrPH and taken on a leadership role, leading a team focused on radiation preparedness at CDC, you, like so many incredibly talented and committed public health leaders, were riffed. As I shared with you earlier, you are not and have never been defined by your job title. Your wealth of knowledge and experience will not go untapped for long. And we stand with you and we will persevere. Joy. Speaking of talented, committed, and strong women and public health leaders, I'm not sure if you remember your DrPH interview, but I do. I asked you about your long-term goals, what success would look like, and you paused, and you told me you didn't know, that your career had already so surpassed what you might have imagined. It was hard to see beyond what you had already been able to achieve. Your answer, Joy, was a powerful lesson to me about my privilege and the assumptions I make about making space for dreams and long-term career goals. Well, Joy, I now know what success looks like, and I'm looking at it. It has been amazing to learn with you and to see you bring a public health lens to your work leading student health and wellness at Georgia Tech and beyond. Your dissertation work bringing mental health prevention to Georgia Tech housing and residential life was particularly powerful, providing additional opportunities to bring a public health and health equity lens to new partners and sectors of the university community. Lauren and Joy, you are both powerful examples of what is possible when we allow our passion, our imagination, and our creativity to move beyond societal and institutional boundaries and limitations. Both of you give me tremendous hope for the future of public health and our collective work to improve health outcomes and opportunities in spite of the immense challenges we face. I feel obligated to comment on those challenges that we face as a nation, as a world, and especially as a public health community. Let us be clear. Our public health house is on fire, and our community and the communities we serve are under attack. To pretend this is part of some rational or grand plan, or to soft pedal it any other way, would be dishonest and disconnected from the reality we face. We are facing a rogue administration, a regime that with no clear plan, strategy, or rationale, other than to exercise and expand their power and demonstrate their capacity for cruelty, has upended the critical role of public health, not to mention the lives and livelihoods of dedicated public health servants, as well as our colleagues across agencies and sectors. We must claim our space. We can no longer allow the rhetoric and false narratives being propagated by this regime to go unanswered. This is not downsizing or reorganizing or addressing fraud or waste or improving efficiency. This is cruel and reckless destruction of agencies and organizations without reason or rationale. Claiming our space means clearly identifying and calling out the threats that we face. It means responding unequivocally to mis and disinformation and bringing forward public health science, the critical work of public health, and how that work is being systematically undermined in ways that meaningfully threaten the public's health. If public health is about assuring the conditions for everyone to achieve their optimal health potential, and to be sure, it is, we need to spell out what that requires and share that message loudly and clearly. Social justice, health equity, diversity, equity, and inclusion, these are among the fundamental values and goals of public health. These, together with freedom of speech and academic freedom, are the essential underpinnings of our training programs. It is past time for us to stop playing rhetorical and semantic games. The other side is serious about their assault on the things that we value, and we must be equally serious and strong in our response. Lauren and Joy, you truly reflect the leadership we need to meet the current moment and the current challenges, and to help ensure a more just and equitable future for everyone. As you continue your journeys, I urge you to be bold, to be courageous, and to be fearless. Congratulations again to you and your families. I'd like now to call on Joy, followed by Lauren, to share their reflections.
Thank you, Dr. Hyman. I didn't expect to mess up my makeup this early in the program, but good afternoon. It is truly an honor to stand before you today, not just as a graduate, but soon to be Dr. Joy Alexander. We have officially made it. I am a first-generation college student and the first in my family to have a doctorate degree. This moment represents so much more than a degree. It represents perseverance, purpose, and the unshakable belief that anything is possible when you believe, even in the midst of struggle and opposition. Pursuing my doctorate in public health has been one of the most challenging seasons of my life. There were sleepless nights, family members that I have lost that were influential in my journey. Cherishable moments that I was unable to attend, personal sacrifices, and days when the weight of leadership in life felt almost unbearable. I often found myself pouring into others while trying to find little strength to pour into myself. But in those moments of doubt, I returned to my why. This degree is more than a personal milestone for me. It is a call to action. I began this journey in the middle of the pandemic. The purpose was to create lasting changes and help communities receive the support that are often overlooked because there are not enough leaders that look like me. My dissertation examined whether early exposure to mental health education decreases the need for crisis intervention among first-year college students. And what I found echoed what I've always believed. When we invest in prevention, when we center wellness, we ultimately change outcomes. We are currently working in a world where public health is being politicized and undervalued by incompetent leaders with no credentials, where funding is inconsistent and where equity is still an uphill battle. We see policies that restrict access, erase identities, and devalue the lived experience of the most vulnerable. And yet, this is exactly why this degree matters. In today's climate, we just don't need titles. We need leaders. Leaders who are grounded in evidence, driven by compassion, and unafraid to speak truth to power, just like me. Leaders who will fight for inclusion, amplify unheard voices, and demand better for communities in need. I know that there is purpose behind pain, yet this world is in pain. It is hard for me to celebrate this accomplishment when I have peers that have been riffed and removed as public health leaders in a space that is needed now more than ever. I continue to hold them on my shoulders and know that better days have to come, and this cannot be the end. To my dissertation committee, my chair, thank you for pushing me to be precise. Thank you for stretching me in ways that I never imagined I would be able to be stretched. Thank you for knowing that even though my topic is not talked about, it's needed. To my Georgia Tech family, thank you for creating space for this research to grow in real time with real people. To my supervisor, Dean Stein, who is in the building. Thank you for allowing me to lead fearlessly at Georgia Tech while also being a student at Georgia State. It was not easy, yet you continue to push, encourage, and support me in my lowest moments. And always reminded me that I could do it. You always compared my dissertation to running, even though I told you I'm not a runner. Yet I now understand the analogy of the pushing and stretching of what running can do to the body is the same pain that I experienced trying to finish this dissertation. To my colleagues, mentors, and students, you've inspired me more than you know. To my friends and loved ones, thank you for showing up for me in every way that mattered. To my incredible family, your love, encouragement, and constant prayers helped me up when I couldn't stand on my own. I would be remiss if I didn't thank God for His grace, vision, and ultimate favor that carried me to this day today. And finally, to my fellow graduate Lauren and the ones that are coming after me. I know we are small, and I know oftentimes people might not understand the impact and the change that we have. Yet I want to remind you that you matter, your voice matters, your work matters. We did not just survive this journey. We beat all odds and transformed throughout it. We will now be a part of a legacy of scholars and change agents who know what it means to persevere and be resilient leaders. Let us take this moment and use it, not just for celebration, but as fuel to lead, to heal, and to serve. The world is waiting, and we are needed now more than ever. We are ready to take action, and I look forward to us doing amazing things in our future. Stay focused despite the odds that are around you, and allow no one to take your voice or your power. Remember, many are called, but only few are chosen. And we are part of the chosen. Continue to be great, and I am rooting for you. Thank you.
Thank you to all of the friends and family and faculty that are here. We couldn't have done this without you. When I first decided to get my doctorate in public health, my intention was to get the degree that allowed myself to be positioned to lead radiation studies at CDC and gain the and gain the public health background that I had been lacking. While both of those things did come true, what I gained was much more than that. I gained a cohort of friends and mentors for life. I found strengths and skills I didn't know that I had, and feel better equipped to tackle the unknown in the times ahead. This degree has been a journey from our first class together in leadership to the final dissertation. Even if that journey each part of that journey taught me something, even if that something is that art is always way better than SAS, and that I need to stop writing in passive voice like engineering at Georgia Tech taught me. I truly believe this program is something special, and I'm grateful for being a part of it. As we look to the future, the skills and lessons we learned will outlast whatever road bumps we may face. I don't know what public health will look like in the next few years, but we will be ready to serve our communities and continue making the world a better place. I'm so proud to be standing here and be with Joy, who was my parking deck buddy, always told me to cheer up when I was feeling out of place in class, and always brought a dose of spice, reality, and positivity everywhere we went. I love her, and I love this program. Thank you all for helping us achieve our dreams.
The next part of the program has me conferring degrees, but I just have to say, Lauren, Joy, I'm so moved by your remarks, and I just want you to know how much love and support there is in this room for both of you. Um, and Lauren, the challenges you're facing, we're with you. We love you. Let's give them a round of applause. Will the graduates please rise? By the virtue of the authority delegated to me by the President of Georgia State University and the authority vested in the President by the Board of Regents of the University System of Georgia, I hereby confer upon you and each of you the degree described in the official records of these commencement proceedings, with all the rights, privileges, and responsibilities thereunto appertaining. You may move your tassel to the left. Congratulations. I'm going to to call on Denise Cavea to present the candidates for degrees.
Thank you, Dean Lynn. And now it is time to individually recognize this year's graduates. Graduates, when I call your name, you will proceed to the stage as directed to be hooded. We will proceed with your names, and then we will proceed on with the hooding. So each graduate will approach the stage with their chair. I'll begin. Dr. Joy Alexander. Dr. Lauren Finkley. Congratulations to our graduates. So it's such an exciting time of year. And now I will invite Dr. Rodney Lynn for closing remarks. One more hand for our graduates.
Can we do better than that, please? Come on, one more. This is a day of recognition and celebration, and Joy and Lauren, you joined more than 2,000 School of Public Health graduates and over 300,000 Georgia State University alumni. You and your friends and loved ones who've supported you along the way should be abundantly proud of your accomplishments. You're now poised to make a greater contribution to the urgent work of improving the health of local and global populations. On behalf of the School of Public Health faculty and staff, congratulations. Thank you all for coming. That concludes our ceremony. Please join us outside for a reception in the atrium.